Myofascial release to junctional zones, in this case suboccipital, CT, and TL junctions. For TL junction, place your hands laterally along the lower ribs, trying to get a sense of ribs 11 and 12 as well. Do a mild compression. Take the trunk in a clockwise or counterclockwise direction, rotating rather than just side bending, and look for ease of motion versus restricted motion. For direct myofascial release, we will go into the area of increased resistance and use the patient's own regular breathing as a facilitator for the release. For indirect myofascial release, simply go the other direction. For CT junction, from the anterior approach, rest thumbs along the length of the collarbones, with fingers going over the traps towards posterior cervical area. Again, work on myofascial rotation, taking clockwise and counterclockwise directions and looking for either ease or bind. And again, for a direct approach, go into the tighter direction, again using breathing as a facilitator. For suboccipital region, from an anterior approach, rest the fingers along the upper cervical and lower occipital region. Myofascially test by raising superiorly on one side versus the other. From occipital motion, typically the area that moves more easily superiorly is also the direction to which the occiput is rotated. For direct myofascial release, simply move that tissue cephalad on the restricted side and slightly coax toward that hand with rotation. Once again, breathing can be a facilitator for this area.